Thank you, everybody, for coming today. This is a fantastic turnout. Hi, didn't see you in the audience there before, so awesome. I don't even know where to begin with what I have to say to you guys about this, because it's a totally different perspective of what you've heard so far today. I'm not going to talk about numbers, savings, insurance, that kind of thing. I'm going to tell you about the experience. And I think that is so key to some of the success behind not just what we've had at Astia, but what I've heard in just that direct primary care role all over. I've worked at a big system for a long time. When I first interviewed with Astia, I thought to myself, what the heck, you mean there's another option in Marshfield? I had no clue. I was dumbfounded. I've lived in Marshfield for 16 years and I didn't know. I was extremely intrigued. I loved the idea of, wow, I am not going to get paid on RVUs. I'm not going to make my money on what I charge my patients. Like, that in and of itself was the very first thing that I thought, this is cool. You know, it makes you not think about that patient as a number or as a price tag, but as a patient. It allows you to do that. You don't have to think about, okay, is their insurance going to cover this lab, or are they going to have to pay out of the nose, or, you know, man, I barely did anything with this person. I didn't make a dime on that. That was the coolest thing. That was the first thing that drove me to Astia, was that thought. What I encountered when I got there blew that concept even out of the water. I went from being told, you know, you can't have any open space on your schedule and we've got to keep you booked. And, you know, as a newer provider, I was able to keep longer appointments at the bigger system, but, you know, it was constant. Well, when do you think you can move to 15-minute appointments and a half an hour for an annual physical? And when I got to Astia and was told, well, you know, it's half an hour appointment is kind of our go-to for acute things or follow-up, and an hour for physicals. And I just kind of went, whoa, I actually get to talk to my patient like a person, not just a diagnosis, not just a medication refill, but talk to them, find out what makes them tick. Because if I can find out what makes them tick, then I can help them make themselves a better person health-wise, not just physically, but mentally as well. I have a couple patient experiences that I've gotten their permission to be able to talk about. One is summer of 2019 when I started, diabetic patient, 2 types of insulin, mealtime and long-acting, a non-insulin injectable, and an oral medication. A1C was decently controlled, you know, in that 7 to 8 range. That's not great. That's not where we necessarily want it to be, but really not bad. Pretty overweight, not very active. In our journey together from July of 2019 until July of last year, we have her on 1 non-insulin injectable medication. She consistently has an A1C between 6 and 7%. She has lost over 40 pounds. She goes to Fire Fitness, which is like a HIIT training gym, 5 days a week. She does kickboxing. Does she still have some weight to lose? Yeah, she does. But the other cool thing was, because of the interactions we had and some of the challenges I gave her, I ran a 5K with her last summer. Have you ever even kind of fathomed, oh, my provider's going to challenge me to do something and they're going to run a 5K with me if I hit that goal? I mean, as a provider, I never would have even thought that I had the opportunity to do something like that, because, you know, you need to keep patient and personal relationships separate, but really it's kind of, well, no, that they're your patient only. You don't get to make those connections. And then even as a patient, I thought to myself, man, if my provider said they were going to do this with me, I'd probably be a little bit more motivated to do it, a little bit more driven. So she's an amazing story, and it's not me who did that. It's her. She put the work in. I just gave her the tools to be able to do it. And she said to me one day, coming up to the 5K last year, she said, you know, I never knew that I had any other options. I got put on insulin right away because I was found to be diabetic and had a really high A1C, and they just kind of kept adding meds, and there was never any talk about what I could do to get off meds, that it was even possible to get off medications. She said, I thought I was on insulin for the rest of my life. And that made me realize that the time I was able to spend with her, 30 minutes for a diabetic follow-up as opposed to 15, I was actually able to give her information to teach her why things go the way they are, the disease process, the medications, how they all work together, why they're important, all of those things, instead of just, well, you're diabetic, this is what your number is, and we're going to check that every 3 months, and these are the meds you need to take, and this is how you take them at what time. But nothing about how they work in your body or what you can do to help them work better, or what really we strive to improve. It's not just about an A1C number, it's so many other pieces, and that's what made her successful, was she was given those tools because I had the time to be able to do that. I wasn't constrained by the constant, hey, you only have 15 minutes. Well, at least 7 of that is eaten up by, the check-in, the vitals, the weight, the med check, making sure that all their medications are up to date. To me, that is extraordinary. And I have seen that across the board with patients at Astia. Marty, I see that with your patient population. I mean, truck drivers, let's face it, they're hard to get to go to the doctor, partially because they're on the road all the time, right? They don't feel like they have the time. A lot of them don't think that it's possible to become healthy or to stay healthy as a truck driver. And we had an amazing success story out of Draxler Transport as well, of a truck driver with an 80-pound weight loss in 2 years. To me, that's, you don't see that in the big system primary cares, because you're in, you're out. I mean, I love my primary care provider. I still travel to a different city to see him, but I don't get to sit there and go through everything I really want to talk to. He doesn't have time to sit there and educate me about everything that I'm asking questions about. I get to do that for people, and I have seen it change their health, change their life. I was in on that toothpick removal. I recall that.
I didn't make that up.
I know. It was, as soon as you said that, I went, oh my gosh, I remember that. I mean, it's things like that people, they feel like a person. We have other people comment that, I don't feel like I'm going to the doctor when I come up to see you guys. I feel like I'm coming to visit friends. I'm greeted by my name and asked a question about, oh, how was your trip? Or how was your, kid's graduation party? Whatever it may be, instead of what's your medical history number or what's your date of birth? They're greeted as a person when they walk in the door. They have a first name basis with every person who works in our clinic, whether it's an MA, whether it's our receptionist, whether it's our radiology tech. We get to know our patients. That's powerful. It's something that can't be done in the big system. I know that from working in the big system. And I think that is probably one of the biggest takeaways. Yeah, you can talk about insurance, you can talk about saving money, and I understand that that's important. But Jordan, one of the things you talked about was employee retention, and your employees have to be healthy to do that, right? A lot of these, even factory workers, they don't go, they don't know, they don't have time, and we get to change that. That whole landscape changes when they are able to come to a place like Astia. I did leave Astia last fall. I went down to Fort McCoy and worked with the Afghan refugee population. Afterwards, I thought, I'm just gonna do some locum positions for a while. I ended up at another employer-based care clinic in eastern Wisconsin, and thought to myself when I was there, wow, do I miss this? Yeah, I could make some really good money doing some travel positions for a while. Even as a travel RN, if I wanted to, take a step back on my license, I could have made a heck of a lot of money. I wanted to be back with my patients, with the people that I had relationships with, that I knew I was helping. That's what I wanted to do. So lo and behold, here I am back at Astia. It's been 3 months now, I think, and I couldn't think of a better place to be. I appreciate everything I get to do for and with my patients. I don't know if they realize that just what they think I do for them, they do for me in return. It's really amazing to see people take control of their health, to be involved, to be excited. It's extremely rewarding, and that's what, to me, being in medicine is all about. Treating people like people, making them the best version of themselves. So that's what I have to say about direct primary care and Astia as a whole. I know it's totally different than what you've heard so far today, but again, I think it's one of the most important parts. So thank you. Questions? Yes?
How do you help steer some of your patients to specific providers? Give guidance around that? Use your own experience and recommendations? What's that like?
Well, part of that is insurance, who their provider is, where they have to go in that respect. We do have some who, yeah, I know that's where my insurance covers, but I don't want to go there. Okay, well, where do you want to go? These are the other options in the area. So it's having a conversation with them, not just telling them this is where they have to go, but this is really what I'm thinking our options are. This is what your insurance covers. What do you think? What do you want to do with this? And again, it's before you even get to that point, using musculoskeletal stuff as an example. Somebody comes in, it's okay, well, you know what, let's try some chiropractic care, let's try some PT. If we don't make it with that stuff, well, then we can do maybe some stuff here in office, whether it's an injection in the knee if we need to, and then we'll get to the referral at another point. If we make progress, great, we're going to stay on that road. If we don't, we're going to get you where you need to be. But they have to be involved in making that decision.
I was going to say that so much trust has been lost in healthcare, the way it's become politicized, with the cost of healthcare going up. And it's not just trust between the patient and the provider, it's also within the organization and these bigger systems. And so a lot of these people who are working in these big systems are not happy with the situation either. And that spills over into the short relationship that they have with others. So I think, trust is a very key issue. It used to be that there was a very meaningful and strong and productive trust between healthcare providers and their patients. And with insurance, with intervention, with micromanagement, whatever you want to call it, that relationship has been a huge barrier that's been created there. And I feel that this sort of innovation is bringing back that relationship and it's bringing back that trust. And so people kind of let their no trespassing signs down and will actually tell you more about
Absolutely.
things that are important, things that are relevant, and things that help you to help them better just because they trust you.
Absolutely.
I thought that, my perspective is it's not only important for the patient, but it's important for the provider in that system, the type of system that they're in. And in this kind of a system, you can have good trust on both ends. I'm interested in your take on that.
Yeah, no, I totally agree. I've had people say to me, I have never brought this up with my provider in the past, and this person has been my primary care provider for 10 years. But as we sat here and talked, I felt comfortable, and I thought, hey, maybe I should bring it up to you. And guess what? It's something that was really, really pertinent to their overall health that now they're comfortable with. And they talk about it as soon as they walk in the door. It's not anything they feel that they have to hide or be ashamed of or that they're not going to get treated for. That trust, that relationship, it goes way beyond being a patient of our clinic. We really do develop relationships with our patients. I can't run a 5K with everybody, right? But I mean, I do. I see, my patients here in Marshfield, they're my neighbors. They're my fellow churchgoers. They know my husband, whatever it may be. There's connections everywhere. And when I was at Marshfield Clinic, it was always, don't talk to me outside of, I don't know you kind of thing. Unless you say something to me, I'll acknowledge it. Well, there's no denying that I know this person when I'm out in public now, because they come up to me and they start talking immediately and they're saying hi to my kids. And of course my kids look at me afterwards and they're like, you can't tell us how you know that person, right? And I'm like, yep, that's it. And they're like, yeah, we know where you know them from. I mean, they're comfortable even in public coming up and saying something to me because we build that relationship. So the trust is extremely important part of that, and I think it's because we have the time to be able to build that. Yeah. Yes.
I got a question. Provider burnout has always been an issue, but especially pandemic, post-pandemic, it's even more magnified, and there's been a lot of research on that recently. Just curious your thoughts on providers getting out of the system, doing more of this independent type work, getting out of fee-for-service. If you've seen people clamoring, asking you how it's going, that are in the systems, or what's your overall experience has been with trying to encourage that movement to continue so that they can have a better, quality of life, because that's a big factor in providers getting burned out.
Absolutely. That's one thing that seems to be a common thread in interviews with new providers is, I'm burnt out. I'm tired of, having to play by a certain set of rules, even if it's not the best thing for the patient. I'm constrained to this. I'm constrained to that. I only get this much time when I really don't get to give the patient what they need. We hear that across the board. I do think providers that do get into this role don't want to leave. They're back to what they went into medicine for, to help people, not herd cattle.
You get calls daily for jobs. That's what you're asking.
Yeah. I just think it's important that providers don't like this either. It's not like it's a us versus them mentality.
Yeah, it's a kind of a Stockholm principle of incarceration in medicine. Providers are just
they think there's no other way.
Right.
Contract, you get stuck in a non-compete. You're there for 6 months before you can leave. There's all reasons why it's hard to really get out of that mindset and out of those contracts. So, I think there's independents that want to go back to what we went into medicine for, take care of people. So it's really been really rewarding and enlightening, and all these relationships we're talking about today are just very gratifying and very humbling to allow us to do what we actually went into medicine for, take care of people. And just to step back on the benefit plan discussion, we need better tools for providers to be able to navigate plans. I think everyone in this room knows that. There's people who are innovating in that space, and obviously we can't do everything, so if we can build tools that our providers can see in the moment, that they can pull up what your specific plan is, what your referral is, what your incentives are. Right now it's just a bunch of different software programs and spreadsheets, and talking to you guys, brokers and consultants, and trying to navigate it correctly. So it is complicated. It's easy when you work for a system. You just press a button. You go to orthopedics, you press a button, you go to cardiology. Probably never see them again. So and that increases your plan costs. It's not a great provider for a system. We're not trying to degrade providers.
Not at all.
Or systems are definitely needed, but I think those are great questions, and chipping away at these conferences are extremely needed.
Anything else? Thank you.